Harry Reid's gun bill. Talk to me about that.
Well, I don't agree with what they're doing, and I do think there are things we could do. You know what? Let me make 2 points here. One is they just absolutely have refused to look at the mental health element of these tragedies that have involved, whether it was the terrible tragedies of the guns of the last couple of years or the knife on the campus earlier this last week. That clearly the one consistent thread there is whoever does this has a real problem that hasn't been dealt with mentally, and I'm disappointed that we're not adequately looking at that. And there's nothing in the legislation that's been proposed that would have prevented any of the things that have happened. Nothing that would have prevented Newtown, nothing that would have prevented Aurora, Colorado, nothing that would have prevented the Safeway grocery store shooting where Gabby Gifford was shot and others were killed in Tucson. If you're going to solve a problem, solve a problem. Don't just use it as an excuse to beat around guns and the Second Amendment another time.
You introduced the Excellence in Mental Health Act. So give us an idea of what would be inside that.
Well, I'm looking at two or three things. The principal thing that Senator Stabenow from Michigan and I, in a bipartisan effort, are looking at is how we could take the community health center model and add behavioral mental health component to that so that people in our state and around the country that have the same access to would have the same access to mental health help as they have through the community health centers, the federally qualified health center model, to other kinds of help. We had a number of veterans groups this week come on board that are very supportive of this idea of making access to mental health more available. There's something we've been very good at in our state, Tom. We're one of the leading states in something called mental health first aid, where we utilize this program so that people who work with kids, either in school or maybe anybody that works with kids and wants to do this, I think would have access to this program where you take a day or two or more to become truly aware of the kind of things you ought to look out for as someone constantly in contact with young people to know whether they need more help than you can give them in your school setting or than they're getting at home or anywhere else. There are a lot of things we can do in enforcing the mental health requirements for people who've had a violence problem related to mental health, looking for ways to be sure that if you're told you have to see a mental health professional this often, that absolutely happens or there are some consequences. So there are lots of things to do, but I think there's been a studied decision not to get to that critical part of this problem, but to keep talking about guns and the Second Amendment. I think that's going to produce virtually no result at the end of the day. But a lot of things for the president to demand that we need a vote rather than we need a solution.
You know, some of the acts you're talking about, whether it's the Mental Health First Aid Act of 2013 or the Excellence in Mental Health Act, these are bipartisan. We have both sides agreeing something needs to be done here. But you mentioned on the guns a studied effort to keep it focused on guns. So on the political side, I mean, that winds up just feeling like more political than truly going after the problem.
Well, I think that's right. And again, let me just make the basic fundamental point, and anybody that wants to disagree with it, I'd love to hear what they have to say. Nothing that's being proposed would have prevented what happened at Sandy Hook. A bigger discussion of school safety might have some impact there, but nothing that's being proposed regarding access to weapons or background checks or anything else would have made a difference in this problem. And I think that's tragic.
It is 7:43. Hot Talk 93.9 The Eagle, and U.S. Senator Roy Blunt is with us. News Director Brad Trinago.
And Senator Blunt, there was a vote in the Senate yesterday to go forward with the debate on this gun control legislation. The Wall Street Journal this morning was reporting before we went on the air that a lot of senators will do what they can to slow things down, procedurally or what have you, with every amendment that comes up to try and slow down the passage of this. Will you be one of the senators that's a part of that?
Oh, yeah, I didn't vote. I did not vote to move forward with the debate. My view is that it's generally better to debate, but our problem with Senator Reid over and over again is once you give him the ability to move forward with the debate, then suddenly you have all these restrictions on what you can talk about. I would have liked to have seen a much firmer commitment that we will also debate mental health components. We'll also debate things that would make a difference. And I wasn't on the prevailing side yesterday, so we're going to move forward with the debate. At this point, I think we should do all we can to make this a debate that would actually try to find a component that would solve the problem. But at the end of the day, frankly, guys, I don't think much happens here. I think that this is now, like so many other things, become all about politics and not about solving the problem. And if the Senate is able to pass something, it's almost certain the House won't pass it. So this is a terrible missed opportunity. Let's go back to mental health for just a minute, just as an example. January of this year was the first time the Senate Committee on Health had a mental health hearing since, I think it was 2005 or 2007. I don't have that number with me, but it's been at least 7, and I think it may have been 5 since we even talked about mental health in the Senate. Here was a chance to do that. Nobody wants to.
Let's shift the gears. We have a couple of things I want to talk to you about this morning, and we're always tight on time. Senator Blunt is with us. Let's shift the gears and talk quickly about the sequestration, the cuts involved across the budget, and that's affecting things that, here locally. It could affect things like the control tower at Columbia Regional Airport.
Well, I was there Friday. I was at the control tower at the Columbia Regional Airport Friday, really talking to the people at the tower about how much added safety there is when you're in that tower watching the runways and what's going on the ground, as opposed to a nearby tower that can almost certainly line up planes to take off and land in a safe way from Columbia. I'd rather have that control tower there. I think we need to prioritize all the health and safety people that the government would say, you've got to show up if there's bad weather. Those ought to be the people that we take off the grid for line-by-line cutting. The so-called essential to public health and safety employees, like the air traffic controller, the food safety inspector, the border security guard. And I've got legislation to do that. I was able to get the food safety inspectors to where they would show up, and working with Senator Pryor from Arkansas, we were able to solve that problem for the rest of this spending year, where 40,000 Missourians that would have had to each miss 15 days of work will now be able to work at what, frankly, are really hard jobs at these food processing facilities. I think the budget caps are a good thing, and sequestration, the line-by-line cutting, you only have to do if the Congress and the President refuse to allocate the discretionary spending money below the line that the amount of money that the law now says you can spend every year for the next 9 years. And the year we just went through is the 10 years to save $1.2 trillion is what those budget caps are going to do. And I'm supportive of the caps. I'm not supportive of sequestration, but as the only way to get to the caps is sequestration. That's what we'll have to do. The best way to get to the caps is to appropriate the money at the level that the law allows the government now to spend. In a hearing yesterday, I asked the Secretary of Housing what they used to submit their budget, and he said, well, what we thought we needed. And I said, well, why don't you think the administration used the number that the law allows us to spend? Well, they don't agree with that number. And I said, well, you do know it's the law, don't you? And he said, well, it's the law, but we don't agree with the law, or something like that. And it's really not the job of the president to agree with the law. That's the courts and the legislature to decide. The president's job is to enforce the law, and in this case, the law on how much money can be spent.
Senator, I asked Congressman Vicky Hartzler, who represents Boone County, the same question, and I understand certainly your argument about how this should be a priority to have these control towers staffed, but at the same time, especially with President Obama's budget out there and all the concerns about the extra spending there, if we're going to get to a point where we reduce the deficit, cuts are going to have to be made in federal spending. How do you reconcile these two goals, getting the funding back for these control towers while reducing spending overall?
Well, and at the end of the day, it may not be possible to reconcile those two goals, but I sponsored legislation and continuing to sponsor legislation with Senator Moran from Kansas that says, okay, the FAA should fund the control tower program, and then we specifically said what things in the FAA should not be funded in the near future. And so what you do is you look for things that can either be eliminated or put off that have less impact than something like people at the control tower. Again, I'd want to go back to be sure, talking to the people I work for in Columbia, the part of this discussion is safety on the ground. I think very little of this discussion is safety in the air. Now, you do have some visual landing people that can create a concern, but other control towers can do part of this job. The question is, can they do all of the job?
Now, I think that's a great question, Brad, and I appreciate, Senator, your honest response in saying, look, at the end of the day, we may not be able to get this to happen, but you seem to be marching in the right direction. I know we're short on time, but I have to ask you about this other issue. We are getting deeper and deeper into trying to find out what's going on in Missouri with the Department of Revenue asking for additional information from its citizens, storing the information, scanning documents, sharing this information with the Highway Patrol. The Highway Patrol now in Missouri has shared the information we find out a couple of times in the last couple of years with the Social Security Administration, and specifically with carry and conceal permit holders possibly being flagged on these. So my question is, are you up to speed on this story? Will you be involved? We just heard in the last 24 hours with Republican Congressman out of Missouri, Blaine Luetkemeyer, that is addressing this a little bit. Is there some level at which a U.S. Senator would get involved in this?
Well, there could be, and we're going to watch that. I talked to one of our legislators yesterday who called me about this, and I was at a meeting on Friday with Senator Schaefer, who was concerned about a similar issue. May have been exactly the same issue, though I think a lot more came out on Monday than had come out last week. And I try not to get in the way of people in Jefferson City trying to do their job. So if there's some way that our office can be helpful in trying to find out what the federal component of this was, it's something we're going to be watching. But I have confidence that people in Jefferson City can look at that. Another issue that the state auditor brought up recently was transferring a lot of records to a private organization who then try to find out if these people, I understand it included foster children and others, could qualify for federal programs instead of state programs. But suddenly, my concern there would be you've got lots of records in the hands of, in that case, not even government officials that hopefully are totally secure, but certainly should be.
Well, I appreciate you responding to that. And on a personal note, I'd appreciate if you keep your eyes on it really close, because once we know the Social Security Administration was involved in asking for the records and they have been turned over to the federal government, now it is an issue in Washington as well. And with you, I'm in agreement and hoping and believing that we can get this thing taken care of in Jeff City, but it now has some finger extending to the federal government as well. So I thank you for your time. I know that we've got to run, but please do not be a stranger both on the phone and in the studio. We love having you around, all right?
Well, I like talking to you during times like this. I also like being able to drop by once in a while, so I will see you soon.
All right, be safe. U.S. Senator Roy Blunt speaking with us this morning.